Hello again, my name is Mike and this is
Natalie.
And we're both RMTs, and in this video we want to show you a few more things that you can do as home care exercises for sciatica. Sciatica is a very common condition and we see it very often in our practices. So under the current world situation, we're trying to provide some tools for you to use at home. It's also a follow-up video to the one that we just shot, that we were doing some extension work on the table. So what we're going to do now is we're going to do extension while standing, okay? And this is based on the Mckenzie principles of back extension to treat the discs in your back. So Natalie, would you mind showing us that exercise? Maybe stepping forward just a little bit more. Great. Okay. So what she's going to do here is arch backwards around where her thumbs are placed, which is on the low back. So she's going back into that extended position for approximately 5 seconds. So we'll count 5, 4, 3, 2, 1, and then slowly back to neutral position for another 5 seconds. 5, 4, 3, 2, 1. Would you mind just turning your back to the camera so that they can see what the hands look like, and do another set that way? Going back into extension for 5, 4, 3, 2, 1, and then back to neutral. Excellent exercise to help move the disc off of the nerves that are pinching the sciatic nerve roots, or where the nerves come out of the back. Okay. Excellent. So I just want to show real quick what that looks like on the skeleton. Right here we have the skeleton again, and what we're doing is, this is the lumbar vertebrae here. We're extending back like this, and as we do that, it tends to move the disc, these are the discs between the vertebrae, away from these yellow nerve roots. So the sciatic nerves come from these yellow nerve roots down here that bundle together and then go down your leg. So the extension really helps those lower lumbar vertebrae to take those discs away from those nerves. Okay, so that's the standing back extension. The next exercise we want to show is a stretch for the piriformis muscle. And the piriformis muscle is a muscle that's deep in the gluteal region, and it can also put pressure onto the sciatic nerve, particularly if the sciatic nerve is swollen.
There goes the spine.
Okay, so let's go ahead and do that. So we'll take you up into that position. So what we'll do is we'll get Natalie to reach the lower leg, okay? And then what she's going to do is pull on her lower leg first to tighten that area, and then we're going to have her move the knee towards the opposite shoulder across. Are you starting to feel that in there? Okay, so this muscle goes in deep in your buttocks here and can put pressure on that sciatic nerve. So with regular stretching of the sciatic or of the piriformis muscle can help decompress the sciatic nerve. Okay. So that one you can hold for as long as comfortable, but typically anywhere from as little as 10 seconds to up to a minute or so, depending on how it's feeling to you. If it's hurting you to do that exercise, then decrease the time. If it feels good, like it's a good hurt, then continue for upwards of a minute. Okay, so that's the piriformis. The next exercise is actually designed to mobilize the sciatic nerve. And the reason why we want to do that is because when the nerve is pinched in the back, the nerve will swell, and it swells up full of water molecules. And so the nerve physically gets bigger. And when the nerve gets bigger, it has less room to exit the back and go through all the tunnels that it goes down your leg. Okay? So what we want to do is essentially give that nerve some tension so that the water molecules, when you tension a nerve, the water molecules tend to exit the nerve. Okay? And we do this with short duration tensioning of the nerve. for between 3 and 5 seconds. So we'll demonstrate that. What we'll do, we just take a sheet or a towel. In this case, we're using a sheet. And we're going to have you wrap it around your foot. And we'll have you do it so you can show how it's done. Okay? Natalie's very good at this. Okay, so she brings it up to about 30 degrees. That starts to tension the nerve at about 30 degrees. And then we're going to have her draw it kind of across her body, like so. And that puts lots of tension on that nerve all the way down to the foot. She's got her foot or ankle in the toes towards nose position where the sheet is. And that adds extra stretch on the nerve. Okay. If that's too much to do, then put the sheet more around the ankle or lower part of the foot so that there's less what we call dorsiflexion, and then come up and across like that. Okay. And again, we hold for between 3 and 5 seconds. At least that's what we found that works best in practice. And then come on back again. And again, you can rest. If you need to put the leg down again to have a rest, that's fine. As long as we're holding the tensioning for about 3 to 5 seconds. Okay, up and across again. And again, what's happening here is we're tensioning the nerve, so the water molecules are now starting to exit the nerve, and that helps to decrease the size of the nerve and less pressure within the nerve, so we can restore blood flow to the nerve, and when we restore blood flow to the nerve can heal. Okay, so again, we want to do this every single day, and usually I recommend doing it 3 times. In the morning when you first get up, because you're going to feel likely sore and stiff in the morning. And then in the afternoon, take a break and do this. And then in the evening, particularly the evening before bed, because at nighttime is when often we see the swelling of the nerve occurs because we're not moving. Essentially, so night pain tends to be worse than the day pain. Okay. So that's that one. We've done 3 things. So we did the standing extension or the Mckenzie protocol. And then we did the Piriformis Stretch. And now we've finished this video with the sciatic nerve tensioning exercise. Okay, so again, if you liked what you saw on this video, please hit the like button and subscribe to the channel. Thanks for watching, and we're going to make a 3rd video on some more strengthening exercises that we can do for sciatica. Stay tuned for that.
Bye.
Bye.